Welcome back and good to have you. Now, South Africa faces two pandemics, COVID-19 and gender-based violence. Ask Africa's COVID-19 tracker has revealed that the unbanning of the alcohol sales has actually fueled women's fears of GBV cases. Let's get more on this now with Research Director Simone Kakana, who joins me for this conversation. Simone, good to have you. Happy Women's Month and Women's Day.
Tamara, happy Women's Day to you too.
Yeah. Quite an important research that you have for us as South Africans and I suppose the world. But let's get behind the vision of the research data that you're providing here. What's the vision behind it? What were you hoping to achieve?
Well, I think just to start off with it was really just to understand what was happening on the ground. So, the tracker was not funded by anybody, but it was actually funded by Ask Africa itself. And we really wanted to understand what was happening on the ground with consumers, what were the emotions, what were their struggles, to truly get an understanding of, what was happening through this pandemic. And like, as I was listening to the radio this morning, we've hit 501 days. And so it's really taken a toll on South Africans from an income perspective, but also a fear perspective, So consumers were extremely fearful in the beginning of this pandemic around, their own safety, what would this pandemic bring in terms of, their economic, well-being, obviously. And since then, we've seen just how, so many people have lost their income. So, the impact has been so vast, and far-reaching, especially in the South African, context. But it's also taken a lot of emotional strain. So we saw, a lot of depression. So the emotional strain that exists within the South African context is quite dramatic. We've seen, slight declines in the last couple of, 6 months in terms of levels of depression. So we're seeing a little bit of uplift in terms of just that, a little bit more positivity. But I think that also just as with each wave, you kind of see, that emotional impact that it continues to have. And as we're just, going through our current third wave, the anxiety and the depression and all that kind of stuff is definitely very, very high within South African context.
All right, so I have to ask you this very difficult question because we do have a problem with GBV in South Africa. What's the state been like for GBV during this COVID-19 pandemic?
Yeah, so I think what everybody talks about is almost like the second pandemic. And that really was what we found in the data. I think in terms of from a woman's perspective, there was a lot of fear, like 2 out of 3 consumers were saying we really are worried about the increase in domestic violence as well as gender-based violence against, vulnerable women as well as children. And I think that was also just intertwined with, the alcohol ban. So, it's the link between, gender-based violence as well as domestic violence. You could just see that coming up the minute, the alcohol ban was lifted. Women were speaking out and saying, this is really scary for us because, people are walking around not doing anything. And now they're going to become even more irresponsible because, they have alcohol at hand. So it's a very, very stressful kind of, situation, especially for women and children during this pandemic. And yeah, I think for me, the thing is people just are very scared. And there's a lot of concern as to what kind of government support are they getting? Because 2 out of 3 people are thinking, the government needs to support women and children so much more, especially in this context.
It's interesting you mentioned, government support and resources, because I read a report, I think sometime last year, saying the same priority given to the vaccine and being given to the messaging around COVID-19 needs to be given when it comes to gender-based violence.
Exactly. And what we saw in the data as well is that, the only 1 out of 10 people will actually or feel comfortable enough to go to the police, and say, listen, I need assistance, and so what about the other 9 people who are sitting there or really hurt, and they feel that they don't actually have the support from, maybe it's family members, but even from the police. So if you can't trust the police, if you cannot go to the police, then essentially who do you turn to? And when government is not supporting women and children in these scenarios, then, this knock-on effect is so severe.
Yeah, I'm going to let you in a few seconds, but before I do, Simone, what does this research tell us? I mean, if you were to hand this research to government, to different interest groups, to law enforcement agencies, what does it tell them in terms of the action that needs to be taken right now with the urgency that it needs?
I think the key thing is that the action needs to be taken now. Stop having conversations, stop introducing policies, but empower people, empower women and children to speak up. Give them the tools to feel safe, one, and give them the tools to say, I can go to the police station and I will be believed and I will get the protection and the support in order to feel safe. Because if you're not feeling safe currently in that scenario and you can't get out of that situation, then, what do? It's this continuous cycle. So for me, the key thing is, I think for me, women and children have been silenced for such a long time that, their voices definitely need to be heard and be taken seriously. That this is such a real pandemic. Like to say it's a second pandemic. It truly is a second pandemic.
It's really disheartening to hear. But, thank you for highlighting this issue for us, and hopefully government is listening, as well as the enforcement and action will be taken today. Simone Kakana, thank you so much from Ask Africa, joining us today, the research experience director from Ask Africa, Simone Kakana.